as a marketer, you still have your day job, which is figuring out how to commercialize whatever the product is. And then, oh, by the way, you have to sort of build out the IPO deck. That's easier said than done.
So today I speak again with Dave Iannetta. He is a seasoned marketing exec with a lot of experience working with companies at different stages of funding.
You are trying to explain a perhaps very complex, clinically challenging process and pathway to an audience that may be less familiar.
This is our third segment on how to market a little bit differently depending on the stage of funding you're at. Our conversation today is really focused on what you should be doing when you're looking at IPO.
At an IPO level now, you really are talking commercialization and how does it fit in the market? What does that market opportunity truly look like? And how do we actually take this product and start to capture it?
Welcome to Lifestyle Continuum. Let's go. So thinking about our next level, if you will, IPO, quickly maybe bridge the distance between, okay, I've got some sort of institutional investment. Summarize that journey to IPO in a minute or two, so we can talk about that a little bit.
Yeah, you kind of think about the evolution of the story that we've talked about. Sort of in the early days, it's understanding what is the process to get you sort of more validation and to get you perhaps into human testing. Then the next phase is how do you take that and sort of turn it into a product and understanding the clinical application and the fit for patients and the need that patients have for it. At an IPO level now, you really are talking commercialization and how does it fit in the market? What does that market opportunity truly look like? And how do we actually take this product and start to capture it? It's very much a commercially driven, this is where we're going, this is what the opportunity looks like. And I think probably to me, the biggest evolution in the story is you need to be absolutely crisp with the size of the market, how you define all of those things, where is it going, and what truly does the market potential look like. And that's probably the biggest shift at that stage is really having a good, crisp story. Not that you don't need those earlier, but it just gets more and more, very tightly defined. And I think that's an important evolution.
Have you ever seen or heard of a situation where maybe a company got to this stage and then didn't have the pieces in place?
That's a good question. You're probably not going to get very far past the stage if you don't have if you don't have those things in place, or at the least, valuations suffer as a result. Mm-hmm. So, I think you're certainly well served to have that story in place. And that's where at that point, a lot of your partners, whether it's lawyers or IPO bankers, they'll be helping you kind of tell that part of the story. Mm-hmm. So yeah, it's certainly important. Have you seen examples where it kind of falls apart at this stage?
I don't know if it falls apart. It might get a bit rocky. And of course, people come together to save the day. My experience is, especially with maybe smaller companies, sometimes there's an attitude of, well, we don't really need that. I understand that a lot of companies, and you can fill in that, whatever that is, with a lot of different things. But some of the mentality is, well, we're addressing such a huge opportunity or such a huge need. Well, all we have to do is tell people about it, and everything will fall into place. And so they don't really look at what the market is for it. For example, a company that has an initial investment of 1.5 million, and they get to a stage, they bring in a firm looks at it, and I think they may have had a junior analyst on, and they did some quick numbers and they thought it was fine. And then they went further along and they were really struggling. And what it turned out is it just wasn't a big enough need or opportunity, and the money wasn't working. So they had to pivot a little bit. I'm trying to be big, but I think some of the data and the market validation that you can get early on is important. I don't think it always gets done. And you would hope that if you go through the gate of having an institution behind you, so some sort of investment group, they would be present and be driving you to, even through the process of bringing them in, have all that in place.
Yeah, certainly I think I've seen where expectations or assumptions change along the way.
Yep.
And you have to do sort of a forced pivot. I mean, that happens based on what you learn in the process. That can be disruptive and a lumpy process, but sometimes that's the way it goes. And you might, perhaps you get towards the IPO process and then you have to reset and go back and figure out something else along the way because you have a setback with the FDA or something else comes up. I mean, those are certainly real situations. And I think along the way, it's just being able to explain that story of what we learned and what happened along the way. That's what I've seen. If it doesn't go forward, it tends to be more of a setback driven FDA or some type of clinical study failure. You didn't meet your endpoint, something like that you have to go back and retool. And that's a fact of life for sure. And that may necessitate the whole new story, right? I mean, maybe you have to go back and start from scratch, or at least kind of a new whiteboard approach of how are we going to explain this given this particular product failure. And that's a fact of life for sure.
So I'm going to throw you a curveball because I think there's a lot of discussion right now about what may or may not happen in the coming year or two with the FDA,
Sure.
And how that may impact everything in what we do. Any thoughts or opinions or?
Yeah, it's a good question. I mean, it's certainly one that's been on my mind the last couple of days in particular. I think on one hand, the regulations and everything it's a blessing and a curse, but sometimes they're slow to move. Now, I suppose what some of the discussions is speeding up some of those changes. So that's certainly a question. I mean, I think at some level, the clinical data that companies have gotten into the habit of producing, I think that will still speak for itself. I think when you look at the evidence that you have to put together, I don't see that changing necessarily. I mean, a proper clinical study with real endpoints is going to drive a lot of the discussion. I think areas that might get more challenging are if there are certain sort of process steps around preclinical or the kind of phase development process. If that changes, we'll just have to roll with it. I think companies are good at rolling with it, but it'll certainly take some of your investor decks and throw those for a loop if you have to do another set of studies or something like that. I mean, those are certainly questions for sure. I don't know. I mean, what have you seen? What have you seen people talking about relative to that?
I've heard all manner of perspectives on what may or may not happen. Fewer certainly that have a more sort of clinical view than you. I am wondering about something you just said, which is around the clinical steps. Can you look back in either memory or in something that you've seen where there was a big enough, I don't want to say seismic, but a big enough change and shift where companies had to make a change? I think there are always ongoing shifts in how things work. I think the concern is that this time things might be a little bit bigger.
Yeah, I'll give you one example that certainly on my mind of the types of things to watch for. The orphan drug statutes have been around for quite a while at this point, and they've been used to drive a tremendous amount of development and clinical benefits for patients, right? But with that comes product exclusivity, and you get 7 years of exclusivity on an indication. If something like that were to change, I mean, it certainly makes it, a more difficult process to think through commercialization and how does that work and how much investment does it need. And that changes the calculus a little bit on some of those products. So that's not an easy one, but that's one that occasionally gets flagged for discussion. So, if you change some of the fundamentals, I mean, that would take something to get looked at. I don't have a crystal ball as to how that would go, but it would certainly impact a lot of investment decisions for sure.
Yeah, there are a lot of questions right now. I'm wondering, is there anything else as somebody is preparing they're really looking at drafting a narrative that resonates with their investors? We've sort of touched on the three types of investment that you might be seeking, and how you might approach that. Is there anything else any other tips or recommendations you might have for people as they're starting to plan this process? Because really you want to be having a a bit more of a holistic view up front of
Yeah.
what this journey looks like. Any quick recommendations for getting going on the right foot?
Two ideas. One is kind of building on what we talked about. I think there's a fundamental question of storytelling. You are trying to, as a marketer, you are trying to explain a perhaps very complex, clinically challenging process and pathway to an audience that may be less familiar. Mm. So that is both a challenge and also an opportunity. I think that's where, as a marketer, you can really shine at being a storyteller and being able to explain how something very complex and be able to distill it down very simply. That is not an easy task, but I think, for all of us, I think that's part of the opportunity that we do in marketing is how do we tell those stories? And that sort of builds all along the way. The story may change over time, as we talked about, but fundamentally you're trying to tell the story of not just the product, but the company. So that's sort of high level how I think about the opportunity. But the second one is a little bit of a more practical advice, which is, and I would say sort of hard-won lessons around this, is document all of your assumptions, particularly as you build out your market assessment and you sort of build the market opportunity story. Boy, oh boy, just document all that stuff because it will come back to bite you when you're going through, eventually when you get, especially with the IPO process. You have to document every single number. Every number that's in the prospectus needs a backup. And, I'll give you an example. Like, you look at things, lately I'm working on a product in the coronary PCI space, so percutaneous coronary interventions. It's basically for, stents and things like that. And it's a pretty common assumption that in the US, there's roughly 1 million PCI procedures. And you can find that number in 1 million different places, but they're all like other pitch decks like yours. And what I found is that you can't reference someone else's reference. You need to actually go to sort of ground truth and find that actual data point, or your IPO lawyers will shoot it down. And when they shoot down a number like how many patients there are, man, that really messes up a lot of your assumptions. So having all of that along the way, you will save yourself a lot of time and headache to keep all that information in one place that's easily accessible so that when the time comes that you need all those data points, you have it. And that's something I would say the first time I went through the process, less good. The second time, much better. And being able to just quickly, because what happens is, I think with the process, you sort of get into these fundraising efforts, and it tends to be, as a marketer, you still have your day job, which is figuring out how to commercialize whatever the product is that you're working on. And then, oh, by the way, you have to sort of build out the IPO deck. That's easier said than done. And to save yourself the time and effort by having a lot of that material already gathered, I think is a big win.
Yeah, I think so. And looking at this through the lens of messaging to reference and put your hands on any of your data and your source at any point that got you to the point. So if you go along the journey and there are these twists and turns, and then you have to go back, and this is a bit more protective than forward-looking strategy, but they kind of blend. If you go kind of along those twists and turns, making shifts in messaging, maybe somebody may pop their head up further down the road and say, well, I saw you referencing this in an ad over here. It was a really cool campaign, except you have this data point that's going to get us in a lot of trouble. Being able to get your hands on that beyond just kind of messaging to investors, I think is key. And I think sometimes as maybe more creative thinkers, some marketers in the space may not be as organized with some of that, but I would hope that most of the people that we've seen are much more organized and can put their hands on their data very quickly.
Where the challenges happen are, inevitably, as a head of marketing at a small company, you're probably not the first hire, right? So the company has existed before you got there. Maybe they've already raised money before you got there. They probably have. So the bigger challenge is, you walk into some existing materials and then it's like, oh, I need the reference for that. Well, I don't know where that came from to begin with. And I've been through that exercise, which is fun, but that's part of the process, right? So you have to go back and figure out, how are we going to back that up? How are we going to document those things? And, more often than not, you can do it, but sometimes you have to kind of tweak your messaging a little bit to make sure that you actually have stuff that you can document and stand behind. But I've seen that, many times over the years where, there's a slide that the CEO loves that he put together 8 years ago, and, you keep using it. But then when you get there, you're like, well, I don't know where these numbers came from.
Right.
But that's part of the story, is figuring out, okay, how are we going to do this? And if we need to change it, like, we can. But, working through that process is certainly, it's an adventure.
Dave, thank you so much. It's good talking to you again.
Sounds good. All right, Bill, thanks.
So if you're a life science leader or product manager and you have an interesting story you'd like to share, reach out to me on LinkedIn and we'll connect. If you're interested in learning some other lessons in marketing for life sciences or in avoiding some of the big mistakes, I cover a lot of that in my LinkedIn newsletter. So I'll drop the links to those in the description below. That's it. That's the end.